Now, 2 persons are on the run after testing positive for the novel coronavirus at Old Fadama, a suburb of Accra. These individuals, who were confirmed to have been infected by the virus, have yet to be reached by contact tracers 3 days after confirmation of their status. Contact tracers have encountered difficulties convincing, and you can see that picture right there. They've had difficulties convincing the patients to comply with isolation protocols and have since fled the neighborhood. Those detected to be positive have fled since their test result came in on Monday, April 6th. 2020. Head of our health desk here at JoyNews, Fred Smith, is in the studio to tell us more about it. Fred, so I'll have you speak to the videos we're seeing right now on TV. What is happening?
Well, indeed, they went to the community. In fact, the whole of last week, the contact tracers were on the ground since the president announced that we are enhancing our contact tracing and testing. And so Old Fadama is one of the many places they are conducting the contact tracing and testing. They took samples from some people there, and it turned out 2 of them were positive, and that result came from Noguchi on Monday. So the contact tracers returned to this place to try and get these persons to, take them to isolation. Okay. Unfortunately, these persons resisted, and they had to go and bring in security to get them to comply. Okay. Now they've been going. We are on the 3rd day. And they found it very difficult getting them to come to isolate them from the population there. This is Old Fadama. No. It's a slum area where houses are built very close together. People share rooms, many people in one room, and there's no space if you want to. So the nature of the disease is such that it spreads amongst people who are close together. And that's why the president announced the social distancing protocols. But unfortunately, these 2 individuals, one of who we know is Kayayo, or head porter, that person is also resisting the, refusing to go into custody. I'll bring you a sound of that interaction between the officials and the community leaders shortly. Okay. But this person, we're told, lives in a single room with 15 other people who also have 3 children in addition, all of them in that single room. It is this lady who tested positive and has been sleeping there with these people who has now left that community. She can't be traced.
And Fred, I'm a bit curious. When they did the testing, did they have to do the testing and go away and bring the result?
The way the testing is done, your samples will be picked today, and then they take them to Noguchi or whichever testing center. Then they receive the test results after some time, maybe a day or 2. Once the test results come and you are positive, you will be notified that this is the result of your test, and then the necessary actions will be taken. If you turn out positive, then you have to be taken into government isolation, or if you can isolate at home. Your house is such that you can. Then you can do that.
But did this person show symptoms for which reasons they had to do the testing?
No, not at all. What is happening with enhanced testing is you pick populations at random and test them for COVID, because you never know where they've been to or what they've been doing since the outbreak of COVID. And so that's how come they picked samples from these people. When we got into the community, it was such a difficult time trying to convince them. The contact tracers, there were doctors amongst them, immigration officers, and the police, all of them trying to get the community to understand that there's a need for them to yield to the testing, because this lady would have come into contact with them, with this person who is found to be positive. But the community members are unwilling to test, and shortly I'm sure we'll be hearing from them in that interaction I captured when I went to the community.
Sina, the lady will be here by 8:30. That's why I'm telling them that if they fail to get that, even the next room, some Kayo people here, because of that, they won't go outside. Friends, greeting friends, find something to talk. So by 8:30, we should be here. That lady, we are encouraging them to take the lady to go and test that serious test because he is the one approved that this is what happened for him.
Does he have a telephone that we can call?
They have their number, but if they call him up, that is going forward. It's no more time.
Our interest today is one of the only the contracts around.
Yeah. So, but what are they? They are refusing to do the testing. No one wants to test. Wow. So this lady and the gentleman
have tested positive.
They tested positive. Okay, but we are struggling to get back. Since when?
We have been 3 days now. We've been here 3 consecutive days.
So you don't meet them anytime you come?
Yes, they don't pick our call. We can't. They don't want to cooperate.
Before they come, they are calling the parents. I hate you don't want to.
Then it means that this one, you the elders must step in because
they didn't tell anybody. Only thing like the girl. After the leave, I will hear it. After the leave, I will hear it.
Anytime she's around, we can even call you. You come and pick her.
You have that.
That's the right.
But the issue is this. She's not showing any signs of COVID, but she has it. So if I'm standing here, like at the level, she can give it to the chaplain for her. Whoever is around this, and when the person is also infected, the person will be giving it out to other people. That's the danger of this.
But the person where you get, you never consult him, you never protect him. How can you get another one? That's what the people say do not agree. Because the first one you come and test, and you accept suspend that the follow you have it. 3 days today, you didn't do anything. So if somebody come and test him,
they come, they don't get
you protect this one before that you get the rest. Protect this one before you get the rest.
That one there. For that one, that one they never do. We are so thinking about
Boss, I think we have to tell your story so that they can give you some more support. Come. Yeah.
So that is an interaction with contact tracers where head of our health desk was there, Fred Smith himself was there. Let's find out exactly what sort of conversation was going on here. We see you asking where these people are. They tell you that these people, they've been coming in and now they don't find them. And then we see also the interaction with people who seem to be opinion leaders there. Exactly what's going on here?
Well, the contact tracers had approached the community leaders who sat under this shed you see on the screen. They wanted them to help in tracing or tracking where this person who has tested positive has gone to, so they can take them and give her help.
Right.
Unfortunately, they are unwilling because they are saying the day they took the samples, the community leaders or the opinion leaders were not consulted before they took the test, and so they are not willing to help. Then they say, all right, this lady has tested positive. She lives in this community. She does a lot of things there. There's public toilet, there's public bath, like they sell things there. She goes to everywhere. And she sleeps in the same room with 15 other people who also interact with the rest of the community. So we want to take samples from all of these persons who are contacts of this lady to test and see if everybody is fine. And the community leaders are resisting. In fact, it was difficult. That's the official. The man in white is the leader of the contact tracing team. He was having a real tough time convincing the community leaders, and that's how I got in to
try and have a conversation.
Exactly.
But this is a national crisis. This is a public health issue. When there are officials, security officials, to compel them to do what they ought to do?
There were policemen who accompanied them, but I'm sure you'd need much more than 4 police officers. The crowd there was heavy, and any attempt by the police, I'm sure it would have been more chaotic than you're seeing on the screen. But the people believe that the contact tracers are just drawing their blood and giving it to government so that government use it for rituals. And that's very unfortunate.
That's what they're saying.
That's what they're saying.
Right. A lot more education needs to go on there. Fred, what else should we know? How was this even resolved, by the way?
Well, the contact tracers and the security team had to pull out of the community. So they went back to the Old Fadama police station to re-strategize. They had been told by the leaders that they can only help them on Sunday when the lady is at home. As we speak, we also saw a lot of the KIAs in the market. So it's unclear whether this lady is actually part of those who are mingling with those in the market.
Well, some people will say that we will need a lot more security, people from security agencies to try and compel these people to do
in the morning, I mean, this message has gone round that these two
are positive.
And
do they even understand the implications of having people like that live in the community?
Well, they don't seem to understand.
Right.
They think that it is a state against them.
Interesting. Fred, is there any other thing that we should know from your trip today to Old Fadama?
Well, the other place I went to was the market, and also checked the compliance to our lockdown measures announced by the president, and it doesn't appear that many people are complying. There was heavy traffic in town, and that report I'm sure will be coming in.
Will come shortly. Fred, thank you so much. Fred Smith is head of our I almost said security desk. Fred Smith is head of our help desk, and he's been combing up and down throughout this country, trying to bring us all of those details, exclusive details, I should say. Today he was at the Old Fadama Boboloshi market, to be precise, and you've seen the details coming out from there. It looks like a lot more education needs to go down there. The people have extreme misconceptions about what is happening, and they are actually comfortable to keep two people who have tested positive to COVID-19, saying they'll only release this person on Sunday. Fred is still here with me. Looks like there's a bit more information you need to give us.
Well, there was a suggestion by someone who was supportive in the community. He had given off his samples, and the officials had taken it to Noguchi for testing. But his suggestion was that the free food that the government comes to give to these people must be tied to you taking giving your samples to the people before they go, because whilst we were there, all the people were asking for was food.
Very very difficult situation, I should say, and that puts authorities in a dilemma, but hopefully we'll find a way around this. For me, it's just about the education going down, that this could kill you. Leaving these two people in the neighborhood could kill somebody, could kill a lot more people, but obviously they don't understand. We'll get more of that story as we go along right now.